The opioid epidemic in the U.S. has become a significant public health crisis. In 2019, more than 64,000 people died due to opioid-related deaths, which is almost triple the number of deaths in 2011. The epidemic disproportionately affects people living in poverty. Public policies such as prescribing restrictions have helped reduce the number of opioid prescriptions, but have failed to reduce opioid-related deaths. The Affordable Care Act, Medicaid expansion, and CARA have increased funding and access to opioid treatment facilities. As deaths have risen, so has the amount of funding. We used the CDC Wonder and the National Survey of Substance Abuse Treatment Services databases to investigate any correlations between increased access and funding to treatment facilities and the number of opioid-related deaths. There were very low to no correlations between opioid-related deaths and the number of treatment facilities, and again between the opioid-related deaths and the number of facilities offering free services or accepting Medicaid. Next, we compared Medicaid expansion states to non-expanded states, showing that Medicaid expanded states had higher rates of total opioid deaths, pharmaceutical opioid deaths, and significantly higher heroin deaths. Finally, we analyzed the percent change in opioid deaths per state with an indication on the graph of when the state expanded Medicaid. There was no significant observations from this. Some future directions we'd like to take with this project are to look at each state's individual Medicaid expansion, investigate exactly which states expanded substance abuse coverage, and compare that to states that didn't. And we want to investigate naloxone prescribing changes and its connection to opioid-related deaths and Medicaid expansion. Our overall conclusion from this study is that increased funding and access to opioid treatment facilities has not reduced opioid-related deaths, but this could be a consequence of treatment center capacity limitations rather than access limitations. Thank you all for listening to my presentation.